The eMEN project has the goal to promote and disseminate the idea and the products of e-mental health in Northwest Europe and maybe beyond. It's not enough to just introduce it in a clinic or in a praxis or wherever. It needs also the framework which needs to be developed for this kind of new treatment from various aspects, be it ethics, be it privacy, be it the evaluations of this kind of new models and techniques. There are so many developing very quickly, which not all of them have undergone proper evaluation, but still they are used by people because they can download it and use it.
Digital technologies can potentially solve some of the issues in terms of mental health services in Ireland. So they may give better access, shorten waiting lists, but also what's quite important from the mental health reforms perspective, they empower the user and give more flexibility in terms of taking care of person's own mental health.
I think all the different countries have different experiences with e-mental health, and we can all learn from that. So some countries are further along the process of implementing e-mental health, and in the entire process you encounter some barriers, and so we can all learn from each other what are really the struggles and how we can really increase the uptake of e-mental health.
We started the whole field, actually. It's strange to say, but 20 years ago we started a research project at the University of Amsterdam, and we were just curious, is it possible to treat people without seeing them? And then we started this whole entire program. So we just have a lot of experience, and I think we treated over 10,000 people online now. So we were very happy to share our knowledge about it. For instance, in Ireland, they're making an e-mental health program now for adolescents, and we're helping now to set up the program and to improve the research. So in that way, we're just kind of consulting with our knowledge.
We see the need to implement and to increase the use of e-mental health in France, being a latecomer in the field and also the country with the lowest use of e-mental health amongst the partner countries at the beginning of the eMEN project. But there is an exponentially growing interest in France on e-mental health, and eMEN can very much contribute to this development.
We've developed 7 products, 2 for depression, 2 for anxiety, and 3 for PTSD. And we have implemented 9 pilots. And we know that this project has already moved a lot of processes forward in an accelerated way. Because if you look at back 4 years ago when we started and you look now, you see a lot more dynamic in the e-mental health implementation field. With the ministries of health involved, associations involved, many e-health developers involved. We hope that this project will bring a great stimulus to faster and efficient implementation of e-mental health.
We all want to improve e-mental health services. We want people to get to know more about e-mental health, the possibilities, and we want to do this on several levels, the policy level, organizations, mental health care organizations, professionals, patients. So we all have the same goal, and that's nice to collaborate.
In Ireland, e-mental health is relatively new, so it's very interesting to look at other countries like the Netherlands, for example, or the UK, where different e-mental health solutions have been already tested and implemented, some of them as in the mainstream mental health services.
Moodbuster is a platform and an intervention for treatment of depression, and through a series of projects we have added things and improved the platform, and now within eMEN we really want to make a final step towards Moodbuster 2.0, as we call it, which will be a new platform where we can also add different interventions next to the current depression intervention.
At the Mental Health Foundation, our particular focus is a preventive one. So, for example, the product that we are piloting as part of this eMEN project is an app which will help people with low mood, hopefully to prevent them from developing more serious symptoms of depression. We think that it's very important, as I think everyone else thinks as well, that all these developments are take on board service users' views, what it means for them, what their concerns might be, what their needs are. So when they're being developed, because it can be a very exciting thing and it can kind of almost start to run away with itself as an idea, but when it's being developed, we mustn't forget all the different people who are going to be the people ultimately who need these technologies, and they need to be brought along, and the technologies need to be adapted also to their needs to make them acceptable to them, because ultimately that's why they will be used in the end. And also we need to work well with professionals and give them education and training and confidence in the different technologies. And again, that will help service users also to feel confident about maybe working in new ways.
The reason I work with eMental Health is to give patients more control over therapy, so they get to work themselves on their own problems. For example, I have a PTSD patient, a Lebanon veteran. I treated him with EMDR, trauma therapy, and we discussed what are you going to do this week in your own therapy. And he downloaded an app, trauma app, EMD app is the name for it. And he started processing his own traumas in between the sessions. So imagine we work on Monday on a trauma session, one EMDR session, and then he treats himself for 6 times that week. And then he sees me again on Monday. So what we see in between the sessions is that the trauma we work on is already desensitized. And other patients, they use a lot of modules online, for example, mindfulness, or they have a lot of rumination, so they use a module for that. And what patients tell me is that they find it very nice to read on it, to see some movies about it, and to get control over their own therapy. And that's very different than the old school coming to a therapist telling you what to do. It's rather a shared process.
We are not only collectively testing a number of products, but we're also producing a big transnational policy solution document with recommendations and an action plan, and we really hope that this can be very helpful at the European level, but also in individual countries.
So we really hope that based on our studies and the results from the other partners, that we can guide institutions, that we can guide organizations, guide policy levels to help them in implementing eMental Health in their workings.